Mr. President, I was interested to hear my good friend talk about the uncertainty of the appropriations process. And frankly, I think we could debate no issue that would change the Congress more totally than the issue of getting back to the certainty of the appropriations process. For 200 years, the principal work of the Congress, the House and the Senate, was to set our national priorities based on how we spent our national trust of the money given to this government by the people that pay taxes, by the revenue to the government. We've gotten out of the habit of doing that. And frankly, one of the reasons we had an authorizing process and have always had that, and an appropriating process, is that gave the Congress the annual ability to look at those programs, see how they were working, see if they were still working, gave the Congress the ability to reach out to a program and have that program answer every question, because there was an annual review of how we spent the money. And if there's an incredible indictment over the last 7 years, it's that the Senate has stopped doing that work. The Republican-led appropriations committees the last 2 years have had all the bills ready for the first time in a long time, ready to do the work, ready to talk about the priorities of the country, and maybe more importantly, ready for the 30 people that serve on appropriations not to be the only people that get to offer amendments, not to get to be the only people that ask and answer questions, not to be the only people that get a say in this process. That's why these bills need to be on the floor. What a tragedy this week and last week that the Defense Appropriations Bill, the primary responsibility of the federal government to defend the country, that bill isn't even allowed to be debated by the minority, because they say we want to see what the final bill would say before we're ready to debate the Senate version. There is no government bicameral two-legislative body chart in the world that shows how one group decides what the final bill looks like before the other body of the Congress is allowed to pass a bill. That's just not the way this works. There's a Senate bill, there's a House bill. Those two bills come together. You know, the country, for good reasons, has forgotten the basic civics of how our democracy works, because the Senate particularly has been such an obstacle to that democracy working for 7 years now. 5 years, we were not able to amend the bills, and that was a reason not to go forward. And by the way, it was a good reason not to go forward. And then for 2 years, we don't want to debate the bills because apparently we don't know what they're going to say before they get to the president's desk. That is not how this process worked. Last month, for the first time in 7 years, the Senate Appropriations Committee on Labor, on Health and Human Services, on Education, passed a bipartisan bill. Came out of the full committee 29-1. That's a good vote, but that still means 70 of the senators haven't gotten to weigh in on what that bill should look like. If that was the case, could be the senators who are concerned about opioid abuse, which I want to talk about in a minute, the senators who are concerned about whether that's going to be funded or not would be less concerned if they knew we were back to the constitutional way of running the government. You know, as chairman of the Labor and Health and Human Services Committee, I was pleased we were able to write that bipartisan bill. Certainly, Senator Murray, the leading Democrat, didn't get everything she wanted in this bill. I didn't get everything I wanted in this bill, but we were willing to set priorities. And one of the priorities I want to talk about for a few minutes today before we all go home and have a chance to talk about the good things that could happen in the country if we just will do our job. One of those priorities would be returning to year-round Pell Grants. Now, Pell Grants are the grants available to people who, because of their family income or their personal income, qualify for not a student loan, but actually a student grant. And until 2008, we had several years to where you could go to school and you could go to school year-round. and still have access to those Pell Grant funds. Recently, I was at Harris Stowe State University in St. Louis. I was at Mineral Area College. I was at Ozarks Technical College and Missouri State University in Springfield. I was at Three Rivers Community College in Poplar Bluff, talking about what happens if people are able to stay in school once they get in school. You know, one of the students I talked to at Harris Stowe, Tiara Wilson, she was a 21-year-old senior who was about to graduate. She was going to school pretty much on her own resources, her own part-time job. She needed to get done as soon as she could. And so she decided to take summer classes, but since she didn't have the opportunity for year-round Pell, she could only get the Pell Grant for 2 semesters instead of the way it was until 2008. She could only get that money for 2 semesters, so she had to borrow the $3,000 it took her to finish her degree sooner. But the good news is she's going to finish her degree. The bad news for her is she has an additional $3,000 debt that she wouldn't have had. The Joplin Globe, the Joplin newspaper, recently shared a story about another student who also has gone to school on Pell Grants, Andy Hammond. He's a senior. His mom and dad run a small business. According to that story, he's always depended on financial aid because his family didn't have the resources to pay tuition. Financial aid to pay that tuition, they said it hadn't been easy. He had to take classes, and when he did take classes in the summer, he had to borrow or out of pocket come up with the $800 to $1,000 that the Pell Grant would have covered. When I was at Mineral Area Community College, the president of that Mineral Area Community College, Stephen Kurtz, said when you talk about affordability and accessibility, you're right in the middle of this discussion on what happens if you have access to help year-round as opposed to just 2 semesters a year. Jean Merrill Doss, who serves as the Dean of Student Services at that college, said 60% of their student body is dependent on Pell Grants to attend school. You know, as a college student, I went to school as quickly as I could. Nobody in my family had graduated from college before. I went 3 years, 3 summers. It took 124 credit hours to graduate with a bachelor's degree. I had 124 credit hours. I didn't have an extra hour. I couldn't pay for an extra hour in my view, and I needed to get college behind me or I might not be the first person in my family to graduate from college. In fact, the first teaching job I took at Marshfield High School, Mr. President, my grandfather was the janitor, had been the janitor when I was growing up at the school that I took my first job as a college graduate at. You know, students like Tiara, students like Andy need to have the opportunity that we can give them to go to school and finish school. Pell Grants benefit about 7.5 million students annually. The maximum 2-semester Pell Grant is will be $5,815 in the school year that begins next fall, but $5,815 pays for tuition, fees, books at every community college in Missouri, and we have a big community college system. So for people who have the most economic need, we already have free 2 years of college in our state, and in a couple of our universities, you can still get all your tuition, all your books, all your fees paid for with a Pell Grant. But what's the advantage of being able to stay in school once you get started to school? You know, if you're the first person in your family to graduate from college, Mr. President, you and I are 2 of the 3 former university presidents here in the Senate. And so we've talked to lots of students who had to have financial aid, had to have help to go. And if you're the first person in your family to graduate from college, or you're going back to school, maybe taking a break, didn't go to college, college didn't work out, you're an adult, totally responsible for all of your college expenses if you're going to go. Staying in school makes a big difference. If you decide you can't go that summer semester because you can't afford the tuition, and you get the full-time summer job, it's real easy for the full-time summer job to then turn into, well, I'll do this job one more semester and I'll get back in school in January. And in January, it's real easy to think, well, I'll go ahead and finish my job and save a little more money this year, and I'll get back into school the regular time next fall. And before you know it, life gets in the way, things happen. You intend to continue to go to school and finish and get your degree, but it just somehow doesn't happen. Those students who want to continue their classwork year-round should have access to the Pell Grant help that you'd have if you were a little more flexible and had a little more ability to take a part-time job in the summer, live at home with your mom and dad, do whatever you're doing there, and start back in the fall. Year-round Pell is not for everybody, but it's expected that an estimated 1 million students of the 7.7 million students that get Pell, 1 million of them would take advantage of year-round Pell, and that includes 20,000 Missouri students would take advantage of year-round Pell. They get an average of about $1,650 each to take advantage of that other semester. Another semester to catch up, another semester to get ahead, or another semester to just graduate faster. This is something we need to do and should do. I want to speak for just a couple of minutes about the other topic that was just discussed on opioids. Clearly, this is a problem. About 1,000 Missourians every year die from opioid overdoses. In St. Louis alone, deaths related to opioid abuse have increased 3 times since 2007. An estimated 1.9 million American adults have an opioid use disorder. This is truly a public health crisis. Every corner of the nation, from our major cities to our rural communities, and there's some evidence that rural communities even have a bigger problem with opioid abuse than in the city. But I was visiting over the 4th of July weekend with some St. Louis firefighters who are also in the first responder team, and it's clear that this is something that 10, 15 times every day and more on weekends, they're responding to opioid overdoses. If you're in a fire department in America today that also has a first responder unit, you're 3 times more likely to go to an overdose than you are to go to a fire. Now, the good news is there's treatment. 72% of the Missourians that went through the state's opioid treatment program tested negative with any random test, and so there is a solution here. The problem is that only about 10% of the people that have the problem get in the program to solve the problem. That's why yesterday the bill was passed that I co-sponsored that dealt with the idea of opioid abuse. This agreement expands access to evidence-based treatment, recovery services, focuses on proven strategies that really strengthens people's ability not to get addicted, and if they are addicted, to figure out how to no longer be addicted. This appropriation that we've recommended a 93% increase in the money available. One of the issues that Senator Wyden was concerned about was whether there'd be enough money. So between last year and this year, we've increased the money by 542%. Takes an unbelievably effective government agency to deal with more than a 542% increase. But we're going to continue to watch the bill, to watch the need, to see to do everything possible to see that the money is available. The House has ideas here, we do too. First responders are not the people who need to be primarily focused on this job. They need to be there when they need to be there, but we've got to do something that solves this problem. People also, by the way, need a place to go. That's why the Excellence in Mental Health Act that will have at least 6 and maybe as many as 24 states January 1 treating mental health like all other health provides that important access point for mental health issues of all kinds and opioid issues that can only be dealt with in that context of overall health involving mental health. So, Mr. President, I hope we will begin to work more openly, more transparently, more committed to solving problems than we are committed to just complaining about problems, and I yield the floor.